Good morning. My name is Tracy Song, and I am one of the Pre-Physician Assistant Programming Coordinators for the 12th Annual Pre-Medical and Pre-Health Professions National Conference. It is an honor and privilege to be introducing today's next keynote speaker. Ms. Deborah Burger is a Sacramento native and grew up during a time when career options were limited for young women. She chose the path of nursing, and today she is the co-president of California Nurses Association and National Nurses United, which is the largest professional union of registered nurses in U.S. history. Practicing as an RN for over 40 years, she has had experience in almost every hospital unit. She has also successfully advocated for landmark nursing legislation to improve whistleblower protection, nurse title protection, and medical advice standards. Because nurses are the patient's advocates, she has empowered nurses across the country to voice their opinions about the importance of patient safety and improving the quality of patient care. As an influential and inspiring figure, she has helped guide the field of nursing into a new era of solidarity. Please give a warm round of applause for Ms. Deborah Burger.
Thank you very much. Thank you. Okay, good morning, everyone. How is everyone? Still asleep? Good? Okay. I was asked to talk about empowering the next generation of healthcare professionals. And I was asked to talk a little bit about my personal journey, my journey with the California Nurses Association, National Nurses United, and just talk a little bit about patient advocacy, nursing advocacy, and how we end up being with the community and doing community advocacy. So when I was first in nursing, as you heard, there were very few options and for women, nursing, teaching, being a housewife, those were probably the big ones. When I was in nursing, first in nursing, the housekeepers and other healthcare workers probably made a lot less than the gardener outside. Nurses especially made less money. The gardener where I actually worked made more than I did as a nurse. And we've come a long way, mainly because we've had to advocate for ourselves and for nursing. And I think that here in California, we have made a huge difference in moving the nursing profession to another level, to something that both men and women can actually take care of their families and provide a level of comfort and security in retirement. When I was first in nursing, we would get up and offer our chair to the doctor. We very rarely disagreed with what the doctor had planned, but over the years, we've developed a way of communicating with doctors and other healthcare professionals, mostly on a level where all of our opinions are expressed and listened to and acknowledged. So when I was first involved in my union, we pretty much did what you would normally think a union would do. We advocated for improved working conditions, to be able to advocate for our patients better, to make sure that we had an adequate pension and health care benefits, because when I went into nursing, very few nurses actually could afford health care for them and their families, even though they were providing health care and nursing care to their patients. So what happened in the early 80s is we actually started taking over our union and started advocating not only for nurses in our union, but for nurses and patients in general. So when we started our fight for nursing ratios, we actually started looking outside of our hospitals and thought it didn't make sense to have nursing ratios in in the hospitals that we represented nurses in, because our family members could end up being at any hospital. So we wanted to make sure that they were statewide. So that took 10 years to actually come about, but in that time frame, we actually started working with other community groups on getting them to understand why safe staffing ratios were really important to them as a community member. So with that, we moved outside of the traditional view of what unions normally do. And we also started making diversity a key component of everything we did. When we took over our union, it was pretty middle-class white women. Very few men, very few people of color in leadership positions. And we made it our priority to make sure that we were inclusive of other people of color and welcoming in the male gender to nursing. If you look at all of our actions, you'll see that they actually reflect that. Now this is a slide that talks about the Hippocratic Oath. We all know there's the Nightingale Oath for nursing, right? Anybody know the Hippocratic Oath? The do no harm, that primary principle, right? Sort of the precautionary measure in many instances. But if you actually look at the Hippocratic Oath, translated from the original Greek, it actually says, "I swear by all the gods and goddesses, I will fulfill according to my ability and judgment this oath and this covenant. I will apply measures for the benefit of the sick according to my ability and judgment. I will keep them from harm and injustice." Okay? So what we did as nurses was use that oath and made it our own in our union by standing up for our communities. So we were quite involved in the Detroit water shutoff scandal. We wanted to make sure that we were able to be there and lend our voice, because it really did create a public health hazard to have people have their water shut off and not be able to provide for their families. Now, you heard in the news that it was some freeloaders and all of that. Well, you're right, there were some freeloaders. There was a huge golf course that hadn't paid their bill and owed millions of dollars. There was a skating rink and a sports stadium that also owed millions of dollars, but they managed to cut off the water to people who owed maybe a few $100s. So standing up for people in the community when you need to be an ally and use your voice as a nurse, not only at the bedside to advocate for your patients there, but to advocate for patients in the community, because it doesn't do us justice to actually talk about how much we care for our patients and how well we advocate if we can't raise our voice and talk to the patients in the community. So then we also believe that healthcare is a human right. If you looked at anything in the last few weeks, you understand that people tend to see your color first, your race, your gender, and sometimes make certain assumptions, and it really doesn't help us if we're not listening to the whole story. It was a tragedy that the doctor and the nurse didn't actually get to talk about the patient from West Africa that was carrying Ebola, because the nursing staff were so busy, and the doctors in the ED, they didn't actually get to use their communication skills, and it had a number of untoward consequences. So looking at those kinds of things, we really need to make sure that we get the message out to the community that it doesn't really help us to be an island, right? Closing the borders doesn't work. Banning travel doesn't work. Segregating certain communities doesn't work, because you can't wrap saran wrap around our country and expect that we're going to be disease-free. We really need to focus on really what will keep our communities safe. And that's making sure that everybody has adequate access to health care, adequate access to housing, community benefits, making sure that everybody has Social Security. Also, real air to breathe, right? There's no jobs on a dead planet. So making sure that we all have a planet that is healthy and provides us with the support that we need. So this is one of our actions that we did in Chicago to highlight the fact that we do need to really look at not only nursing in hospitals, but nursing globally and what that can do, and work with other healthcare professionals to do that. Again, having access to healthcare, right? We want to make sure that we really understand that diseases don't know whether you're covered by healthcare insurance or not. And so we want to make sure that we can do the best to provide that care for our patients. We have a funding mechanism called the Robin Hood tax. That's why all these nurses have little Robin Hood hats on. So if you go to our website, you'll find more information about that. When they say there's no money for health care, you really want to look at other ways to do it, and taxing financial transactions actually works. Since we pay sales tax on everything, why shouldn't the rest of the financial industry? Could raise $350 billion a year, but that's another lecture. We were also working with the communities in Chicago. There was a huge pet coke, it's a byproduct of coal mining, a pet coke plant the train went right through one of our communities that just happened to have the largest rate of asthma and coronary artery disease in Illinois, and it was partially because of these uncovered pet coke plants. So we raised our voice there to have the community understand that there was a direct correlation with the fact that there were uncovered dust piles, 2-3 stories high, uncovered, and every time the wind blew, and if you know anything about Chicago, you do know that one of its nicknames is it is the Windy City. So anytime there was wind blowing, these pet coke piles got a little shorter, and the dust went into our patients' lungs. So we also speak for holding our employers accountable. It doesn't have any good for us to talk about our employers, and they have these nice slogans about the dignity of life and the value that our patients bring to our employers, but we also want to make sure that they are held to their mission, that they are held to their commercials, right? You know, the Kaiser Thrive, the Dignity, Human Kindness, the Sutter, we plus you. We want to make sure that there is a you in there, that we actually can thrive, so we hold our employers accountable. And we aren't afraid to make sure that when our Congress people aren't doing what they should, that we actually hold them accountable and make sure that they do what's right by the planet, our patients, and our communities. So when you are speaking out there and you're advocating for your patients, we actually make sure that you have a voice for nursing, and it can actually be fun to be out there. You don't see anybody in those slides with a sad face. We actually want to make sure that when we're doing these actions, that people actually want to come back and participate, and that they feel empowered to help transform our communities. And I think it makes nurses and nursing more accessible to all of our communities if we are out there relating to them. Most of you probably already know that nurses have a very, very high credibility and trustworthy rating. If you look at the top 10 trustworthy professions in this country, and not coincidentally in many other countries, we're up there at usually number 1 or number 2. I think the one time that we slipped to number 2 was during 9/11. We slid just a little bit, but generally speaking, our patients trust what we say because we speak the truth, because we're not afraid to get into dialogues with our patients, and so they know that we are there for them. And being a community activist is no different than being an activist in the hospital that you eventually work in, that you are involved in providing patient care. So one of the things that I think would really make a huge difference, and I'm really happy to see the diversity in this room, is the fact that many of you have chosen nursing and want to make a difference in people's lives. And what I am saying is that you can not only do it in your hospital, but you can also do it globally. You can do it internationally, and you can make a difference. And that's the one thing that National Nurses United has done over the last few years since we formed National Nurses United, is to be able to work with other nursing groups internationally to raise awareness on the global issues, right? So when we're out there, we speak with that same credibility, because you don't stop being a nurse just because you've left the hospital, right? You're still a nurse. Your relatives, your neighbors actually depend on you as a nurse and want your opinion and value what you have to say. And that is a rare gift that we are given because of who we are and the profession that we choose to be in. So what I'd like to do is just sort of finish up here with an African proverb, which is, if you want to travel fast, travel alone. If you want to travel far, travel together. And that will make sure that as you travel through nursing in your nursing profession, that if you travel together, you will bring nursing far, and you will bring the ability to change the world in nursing. So any questions? Yes, sir.
Could you tell me what was the ratio before and after your advocacy with that?
Okay, so the question was, what was the ratio for nurses to patients before the ratio law went into effect, and the ratios after? So before the ratio law went into effect, it was varied, depending on which hospital you worked at, which unit you worked at. If you were in med-surg, on day shift, you could have 7 to 10 patients. On evening shift, probably 10. When I worked in med-surg on nights, I did the entire floor with 15 to 30 patients, right? Because they were all sleeping at night. And in ICU, we actually had the first ICU ratios in 1972, coincidentally signed by Jerry Brown, where there was a mandatory 1 to 2, right? After the ratios in med-surg, it was 1:5. In the other units, tele 1:3, ICU 1:1. You can actually go to our website and the ratios are on there. Yes, sir?
Yeah, with diversity of the profession in mind, what do you have to say to men thinking about joining the profession?
What would I have to say? Come on in. The water's fine. The nurses that have been here before you decided to enter have actually made it a profession that you can support a family, that you can have a retirement and retire in dignity. It is a job, because of the work that we've done, that would really appeal to a broader range of people. So come on in. Yes, anybody else? You want to go on break? All right, we're done. Thank you very much.